Okay, so this is just going to be a brief presentation just to let you know about a new initiative that, together with the other 23 European reference networks, we have launched recently, and it's just the application to an European Union call. This is a call within the Horizon 2020 program in the topic of, better health and care, and is one type of actions that are called CSA. So CSA's actions are not funding, unfortunately, directly research, but there are funds that are thought to promote collaborative actions among different initiatives on consortia. And then we have taken this opportunity after raising the need with the European Union about a specific topic, to try to enhance the capabilities of the research that can be promoted from the European reference networks. As you know, the European reference networks, we are receiving money for coordination and for several actions, but although we have probably a strong capability of promoting research, the reality is that as we are not supposed to be directly research consortia, we don't receive money to research initiatives. So the idea is that little by little, European Union is trying to align some initiatives that within their scopes could have topics that could be aligned with the research objectives of the European reference networks. So basically, as you know, the 24 European reference networks, we are working together in different working groups, as well as within each network, we have different working groups to tackle different initiatives and different areas. The the coordinators group of the 24 networks also divided our efforts in different working groups. So the research working group has been active for a couple of years, and I must say that in the last year, several initiatives are taking place. So one of them was the idea of applying together to one of these coordination and support actions, really to increase the capacity of the working group of promoting initiatives. So this, we hope that this application is going to be funded. It's not too much money. It's, I think it's around 2.5 million euros for 24 months. So the 24 networks are going to be beneficiaries. And the idea is that within this consortia, or this action, we could really try to promote research capabilities. So the acronym of this call has been designed as ERICA. So the ERICA consortium, as you can see in your screen, is going to be formed by the 24 ERNs, and it's going to be has been designed to increase the strength of each individual ERN to create a platform of all the 24 ERNs together that could really improve our research and innovation capacity. So the idea is to share knowledge, to engage all together with the stakeholders in the field of rare diseases and complex therapeutic procedures and complex medical procedures, and then trying to create some working groups within this research working group, some task force within the research working group, really across the spectrum of ERICA, really to create, for instance, new networks within the ERNs. That means that we are trying, in terms of research, trying to develop common initiatives all together and not individually. So for our particular scenario of transplant child, this could be good because we could really try to look for initiatives of research or to promote initiatives of research, for instance, with all the organ-based ERNs that are more focused on different organs, but that are related to diseases for which transplantation could be the only or the major or the only curative therapeutic procedure. So the idea is to promote the collection of data, to increase the patient involvement in the ERNs, to enhance the quality and impact of clinical trials, and to promote innovation. So the idea is, as you know, we are very well involved in the ERNs are well involved in the ERN in the rare disease scenario in Europe. So the idea has been also to connect with other ERN research bodies or rare disease research bodies or infrastructures, and really is trying really not to duplicate efforts, but to complement some other initiatives that could be ongoing in Europe. So the idea is just to have this structural framework that will last for 4 years. Again, as many other initiatives, we have some uncertainty about sustainability in the long term, but the reality is that in the 2-3 years since the ERNs have been ongoing, the reality is that we see that European Union is doing efforts really to maintain the capabilities of the ERNs, just creating, as I said before, new initiatives to support the 24 ERNs. So one important goal will be to stimulate the clinical research activities, and as in other initiatives, the idea of working together is, as you know, that the prevalence of rare diseases or rare therapeutic conditions or uncommon or highly specialized therapeutic procedures like transplantation could benefit in terms of clinical research and translational research by promoting cooperation and increasing numbers to address better many of the research gaps that we still have to tackle. So this other initiatives has a long proposal that has been very well structured after several months of work. The deadline for the call was originally January, February, but it was postponed due to the COVID-19 pandemic, and finally the application was submitted in June. Because the call the topic of the call is very specific and specifically addressed as one of the options, the research within the ERNs is not a competitive call. So we are pretty sure that because the application was well structured, that we will be funded, and funds are expected for early next year. So as I said, the 5 objectives has been established. One is to record, coordinate, and disseminate ERN clinical research activities. The second one will be to facilitate, as I said before, collection, sharing, and analysis of clinical research data within and between ERNs. Also, there is an important objective that is to really increase or advance in patient-centered research and outcomes monitoring by promoting the identification and application of patient-centered outcome measures for rare diseases and rare therapeutic conditions. As you know, we are really, as ERN TransplantChild, within the proposal that we have started recently, that is the creation of the registry that will collect data from transplanted children, the registry picture that the ERN TransplantChild is promoting. We have an important objective as well, which is to also increase the patient-centered research similarly to this initiative. And for us, that's a very good opportunity really to take advantage of the work that we are planning to do within our registry in terms of prompts and premts for the collection of data directly from patients. And as I tell you before, we are going to be involved in one of the work packages that is going to be specifically devoted to this area. The objective number 4 is to, as I said before, to cooperate and collaborate with other ongoing activities, like, for instance, a big initiative in research in Europe that is now active, which is the European Joint Program on Rare Diseases. That is, again, a 5 years research program to increase the diagnosis and treatments for rare diseases. And finally, really to encourage methodology to increase the capacity of clinical research in uncommon diseases and common procedures. So the idea of how this strategy is going to be applied is that through the ERN Research Working Group, that will be the core for the development of the project. So the Research Working Group of the 24 ERNs involves mostly all the ERNs, and there are several representatives in this working group. And the idea is that it would be through this structure, through how we will just really try to develop this project. In addition, as you know, there are several initiatives ongoing in Europe. So an important part of the proposal has been to detect ongoing activities and ongoing resources and capabilities within Europe, and really to connect with other infrastructures that are already established in Europe. And as you will see, many other partners other than the ERNs are going to be involved in this initiative, really to increase the capability of interaction, and also to avoid the duplication of efforts or to overlap with other initiatives that could be already ongoing. So for this, there is a careful analysis of other infrastructures that are ongoing in Europe. Part of the preparation process of this call was to have some face-to-face and several teleconferences with all the research working group members, and also with other many of these infrastructures, like, for instance, research infrastructures that are specifically devoted to pediatric research, like Connect for Children, or ECRI, which is an European initiative for research infrastrucures. Some of them particularly devoted to children, like Connect for Children, and others just devoted to other more wide research initiatives, and also infrastructures like the Joint Research Program of the European Union. There is a good connection also with other infrastructure, like, for instance, all the initiatives around biobanks in Europe, like BBMRI, the EMA, which is also involved really to facilitate interaction as well with industry. Obviously, all the ERNs, as I said before, the European Commission, and also international and European research initiative focused on rare diseases, like, for instance, as I mentioned before, the European Joint Program on Rare Diseases, in which, if you remember, as ERN TransplantChild, we are also participating, and this is a 5-year program that is now entering the second year of life, and also in international initiatives in research for rare diseases like the IRDIC. So we participate as ERN TransplantChild, as you know, because the ERNs don't have a legal entity by themselves. Unfortunately, we cannot participate like ERNs, and it will be through the coordinating centers. It will be through them how the ERNs will be engaged and will be funded. As you know, Europe is working on trying to somehow create a legal entity that could just or just trying for the ERNs to become at some point legal entities. But so far, this is one of the problems we have in terms of many of these initiatives, and is the fact that we cannot participate as single institutions, but as one only institution. That will make no difference, because obviously all the initiatives that we are going to promote within this initiative as ERN TransplantChild, and any proposal that we'll have will be, of course, shared and agreed with all the members of our network before they are proposed. One of the major resources that we have to participate in this initiative, as I said before, is the fact that we are going to have a registry for children, for transplanted children, PICHER, and is within the 24 registries that are planned to be developed in the ERNs. through these infrastructures, many of the objectives will be addressed in this call. So, as I said before, what will be the impact that we expect for this platform? First, because ERNs are devoted mostly to clinical, or they have clinical objectives, the idea is that this 4 years funding period could help to create a platform or to set the grounds for further inter and intra-ERN competitive networks that, for instance, could have an opportunity through meetings or through training opportunities, or just facilitating interaction in the ERNs, within the ERNs. We could establish somehow other platforms or consortia that could, for instance, be strong enough as to apply for further funding, for instance, in any other Horizon 2020 or further research calls that the European Union could launch. Obviously, we will try to harmonize and to work together to enhance our capability of data collection, as I said before, to involve patients, to increase the quality of clinical trials, and to increase our innovation capacity. So, as any consortium, this will have an infrastructure for governance and management. So there is an office for management and different working groups or working packages. There will be 6 different working packages have been designed. Number 1 will be, as I say, for coordination. Number 6 will be for dissemination. It will be centered in the infrastructure or the managerial infrastructure of the consortium or of this platform. And then there will be 4 more specific or just for working packages that will be more devoted to achieve goals and develop deliverables. Work package 2 could be devoted to data collection and integration and sharing. Working package 3 to patient-centered research. Working package 4, clinical trial and support, and working package 5 to translation and innovation. As you see, all the big infrastructures in terms of research for rare diseases will be aligned with this and have participated in the preparation of the call. So just briefly, I'm going to give some hints about the different work packages. We are going to be very involved in work package 2, devoted to data collection, integration, and sharing. And we have said before, when we talk about registries, the idea is that any new registry in Europe that is going to be developed should just align with the objectives of promoting interoperability and data sharing and interconnectability within different platforms. The idea is just to increase the usefulness of clinical data collection by ensuring this, or just introducing the concept that we have discussed in the past in several opportunities, which is the FAIR criteria, to maximize the possibilities that any data that is collected just incorporates the characteristics of findability, adequate accessibility, interoperability, and to be reusable. So these, as you know, are the principle of fairness. And there are going to be several initiatives like training, like interactions, like harmonization and definition of standards to make sure that we achieve this goal of increasing the verification of data. And then this will also be this work package is devoted to promote clinical research. Work package number 3 is the one that is going to be more devoted to patient-centered research. We are also participating in this work package because, as you know, a very important objective for the registry we are developing, the PITER registry, is to include the option of collecting prompts and prems for patients, really to measure different outcomes that could be related with patient experience in all the process of transplantation. And we are going to share our experience and our definitions, and we are already working in that area, communicating, or we are in communication or in contact with other ERNs really to work together around PROMs and PREMs for children, for instance. And then clinical trial support, work package 4. We will try to work together to increase awareness of activities and opportunities available from different stakeholders. So we are trying to, there is an objective of trying to make sure that all the ERN related researchers, all the researchers that are members of the ERNs, or all the researchers that are connected to hospitals that are part of the ERNs, are well aware of all the resources and the possibilities that different infrastructures offer in Europe. And also, this work package also will promote the engagement of patients in the process of clinical trials. And then finally, work package 5 will also be developed to translation and innovation. As one objective is the capacity building, just trying to increase the capability of ERN-related researchers to maximize their research in terms of translation, and also to help in the process of effective translation of their research findings to really opportunities really for development of different resources or different clinical advances. And then one of the other objectives of this work package will be to increase the strategical capacity of the ERNs really to make a difference with with rare diseases, and to increase the diagnosis and the therapeutic options for rare diseases. And finally, as I said, work package 6, together with work package 1, would be more devoted to the management of the platform, and will be devoted to dissemination and outreaching. So with this, I just wanted to give you some hints. As soon as this call hopefully is funded, we will have more opportunities to discuss all the opportunities that we will have through this initiative. And if you have any questions or any doubts, or Etienne, if